Live. The one and only Local 10 News.
In today's HealthCast, we have encouraging news about a less invasive approach to treating a form of heart disease. Local 10 medical specialist Christy Kruger is here now with the details.
Yeah, nearly 1.5 million Americans have something called aortic stenosis. That's a narrowing or even a hardening of the aortic valve. For those at a high risk for regular surgery, a brand new study shows there's a great option.
I'm going to draw two.
In the game of life, the odds have been stacked against Guillermo Roca. Over the past 30 years, he's been diagnosed with a number of heart problems, most recently aortic stenosis.
I began feeling tired after walking and I had trouble breathing.
Because of his age, Guillermo was at a high risk for surgery, but Dr. Nirot Beohar was able to use a less invasive technique. It's called transcatheter aortic valve replacement. Instead of going through the chest, a replacement valve is inserted right through an opening in the groin.
So the patients typically tend to recover a lot faster and go home a lot quicker with less side effects.
Dr. Beohar has taken part in an ongoing analysis of this procedure. The latest data showing that advances in transcatheter valve replacement have reduced mortality from 23% to just 14% in the first year following this procedure, and from 35 to 24% in the second year.
In some of the series, the follow-up is out to now 5 years to 7 years, and patients continue to do pretty well.
Guillermo is now able to get on that treadmill without getting out of breath.
I'm very happy that I'm still around, and much improved, certainly.
Now, aortic stenosis is typically a problem as we age, but it can happen earlier in life if someone has a congenital valve defect or if perhaps they suffered from a rheumatic fever when they were a child.